The benefits of shoulder replacement surgery is, barring a rare complication, it is very good at relieving pain and improving function. There are risks. With any surgery, there's a risk of an infection. I'd say that's pretty low. The risks particular to shoulder replacement would include potentially fracture of the bone, putting in the implants. Often these surgeries are performed in older people who have not been using their shoulder very much, and they develop osteopenia and weakness of their bone, and that can happen. And the different risks depend on the different type of shoulder replacement that you would consider doing. There's three really. There's what's called a hemiarthroplasty, where we just replace the arthritic ball of the shoulder joint. Then there's a total shoulder replacement, where we replace the ball and the socket of the shoulder joint. And then there's what is called a reverse shoulder replacement, where we put a ball on the socket side and a socket on the ball side. And that is done primarily in people that have rotator cuff insufficiency or significant bone deformity. A typical recovery following shoulder replacement depends on the type of shoulder replacement that we perform. Reverse shoulder replacement tends to progress a little faster, and I'd say it's maybe around 3 to 5 months. A total shoulder replacement might be more like 5 to 7 months, and the hemiarthroplasty is probably around 5 months. Most patients following this surgery express that almost immediately the pain that they had is gone. They will have some discomfort and pain from the surgery itself, but that usually dissipates pretty quickly. And so the pain that they were living with for a long time, usually they'll report is gone. If you're going to have shoulder surgery, we recommend you do a joint class that's run by one of our nurses, and you'll get a booklet that will spell out everything, what you do leading up to the surgery, what you do the day of surgery, and then what's going to take place following the surgery after you go home. I like to give patients adequate time to recover following the surgery, and usually won't start formal physical therapy until about 6 weeks. However, in that class, we do teach them some exercises that they'll be doing at home leading up to the formal therapy at about 6 weeks. If you feel like your shoulder pain is bad enough and or your quality of life is declining from arthritis of the shoulder, myself or any of the colleagues here at Marshfield Clinic would be happy to see you.